come in.
How you doing, sir? Nice to meet you. My name is Andrew. I'll be your nurse. How you doing?
I could be better. I'm having a little trouble breathing.
Could be better. Well, we're gonna do everything that we can to help you feel better. But first, can you provide me with your name and date of birth so
Sure.
that I have the right patient?
Dave Sahani, 10783.
All right. And is it okay if your family member stays in the room with you while we?
Oh yeah, I would like that. Her name is Elena.
Nice to meet you, Elena. All right. So you said that you're having some trouble breathing, Dave. So what I'm going to do first is I'm going to do a set of vital signs on you. So that's going to include your blood pressure. I'm going to assess your respirations. I'm going to check your pulse. I'm going to check your oxygen saturation in your blood to make sure everything's perfusing correctly. And then we'll go from there on what we're going to do from there.
Sounds good.
So first, I'm going to take your blood pressure. You have a preference on which arm?
It doesn't matter. Whatever's easier for you.
Alright. Thank you. Okay, let me just get an alcohol swab for my stethoscope. Alright. You ready, bud?
Yes.
Alright, so your blood pressure is 120/80.
Perfect.
Okay. Now I'm going to assess your pulse for a full minute. Alright, so a minute has gone by and your pulse is 60 beats per minute. Okay, now I'm going to on this side. I'm assessing the patient's lungs to see the chest rising and falling, and I see that the patient's respirations are at 22 per minute. Alright, now I'm going to check your oxygen saturation level. Just take a big deep breath for me, okay, bud? Alright, so your oxygen saturation's at 88 right now. So I'm gonna go ahead and I'm gonna listen to your lungs, is that okay?
Yes, that's fine.
Alright, perfect. Okay, just take a big deep breath through your mouth, okay? Again? 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 Okay. And listen to the posterior side.
Okay.
Big deep breath through your mouth. Again. 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 Alright, so Dave, I am hearing a lot of crackles in your lungs. So that's going to tell me that I should perform some chest PT on you.
Okay.
It's called chest physiotherapy. That's basically I'm going to be using my hands in a cupping motion, and I'm going to be patting your back to try and mobilize the secretions. And while I'm doing that, I want you to, cough so that we can try to get up some of those secretions. Is that okay if we
Yeah,
start
that's
doing
fine.
that? All right. Ready? On the count of three.
So you want me to cough?
Yeah, I'll tell you when, okay? So on
Okay.
the count of three, ready? Go ahead. Okay. Feel like the secretions are mobilized a little bit more?
I don't think it helped much. I
Yeah.
still feel the same.
Alright, Dave, so I know that you said that, it only helped a little bit, the chest PT, the chest physiotherapy, but I just want to take your oxygen level one more time just to see if your oxygen saturation went up a little bit, because it was at 88 before, and you know that's a little on the low side. So I want to see
Okay.
where you're at now. Okay. Take a big deep breath for me. Okay, so you are at 91% now out of 100. So that shows that the chest PT did in fact work a little bit. But what I want to do now, since it still is on the lower end of the normal spectrum, I want to check the doctor's orders because you know you were diagnosed with asthma in the past, and you know this is an exacerbation of that asthma that you have. So I want to check the doctor's orders to see if there's any other medications that maybe he has ordered for you. See if we can give it to you.
Sounds
Okay.
good.
All right. Okay, so it says that you have Ceravent or Salmeterol.
What's that?
So what that is, that's a long-acting beta-2 agonist that's given to patients to dilate their bronchi. So what you have is a disease where your bronchi are constricted, and what this is going to do, it's going to help dilate your bronchi in your lungs to help keep the airway open, so that air can be free-flowing in and out. You have any questions?
Yeah, how am I supposed to take it?
Alright, so we're going to demonstrate the medication now without the actual, you know, inhaler in front of you. So just so I can make sure that, you know, you have
Great
the
idea.
right knowledge of how to do it. So I want to have you just take 2 big deep breaths in and out. Okay. Now on the 3rd breath, if you have the inhaler in front of you, you're going to put it up to your mouth, and then you're going to pump down and inhale, right? And then you're going to take the inhaler away, hold it for 5 seconds, and exhale slowly. So I want you to do just that. So
Okay.
2 deep breaths in, and
on
the third one,
I'll do the
inhale.
pump and hold it. Okay, so
Okay, so that's 1. That's 2. Exhale slowly. Perfect. You did a good job. So now when I administer the medication, now I know I can feel confident that you do know how to do it. Okay? So do you have any other questions for me? If you know, if you want me to ask the pharmacist or bring the pharmacist in to talk to you, she's right up by the desk.
yes. My sister might have a few questions for her.
For the
so-
pharmacist?
Yes.
Okay,
please.
perfect. So just give me 1 minute. I'm just gonna go grab the pharmacist.
Thank
and
you.
We'll be right back. All right? Just give me 1 second.
Come in.
All right, Dave. So like I said, I'm gonna bring you the pharmacist. So this is Lisa. She's our
Hi.
wonderful pharmacist.
Hi,
on the
Lisa.
floor.
How are you?
So whatever questions you have, she'll be able to answer, and I'll be right over here.
Thank you
if
so
need
much,
anything.
Andrew.
Yep.
Do you have any questions for me?
My sister does.
Yeah, what are the side effects of Ceravent?
So some side effects could be headache, that's most important, increased heart rate, you can kind of get palpitations, nausea, increased blood pressure, so just keep an eye out for any of those, and if anything's, you know, like a severe headache, call your doctor right away,
Okay.
Got it.
okay? Also, I don't know what other medications you are taking, but if you are taking a beta blocker, like metoprolol, that can increase the effects of the medication as well.
Well, these sound pretty serious. What do I do if I experience any of these?
Contact your provider right away. Okay?
Okay.
And coffee, tea, or any other herbal supplements can also increase the effect of Ceravent.
Gotcha.
Okay? I do have a little medication card for you to take. Has all your signs and symptoms on it,
Oh,
just
perfect.
so you have it at home. I'll give it to your sister.
Oh, thank you.
Thank you.
Don't lose that, Elena.
I won't.
Do you have any other questions?
No, I don't.
Okay.
Thank
I'm gonna
you
go get
so
Andrew.
much.
No problem.
All right, Mr. Dave. So what we're gonna do now is, you know, the medication's ordered for you. You just spoke to the pharmacist. She explained everything
Yes,
in
she
good
did.
detail. Okay, so I took your oxygen before it was 91. So like I said, we want to administer the Ceravent to try and bring up that oxygen level. So I'm gonna go get the medication now. Can you provide me with your name and date of birth one more time?
Sure. Dave Sahani, 10783.
All right, and you have Ceravent or Salmeterol.
Mm-hmm.
All right, so it's the right dosage, right route, which is inhalation, and right time. So it's 9:25 a.m.
Okay.
9:25 a.m. So you're okay. All right, documentation. Okay. All right, so everything appears to be in order. So now we're gonna go ahead with the medication administration. So what I want you to do is just like we talked about a little bit earlier, and just like we did the teaching. So
3 breaths.
2 deep breaths in, then on the third, you're gonna press down, inhale, hold it for 5 seconds, exhale slowly.
Okay.
All right.
Let's do this.
Go ahead.
So I'm gonna do the practice 2 pumps.
So it's 1. Good. Another third. Now I want to take your oxygen saturation one more time. I want to check to see if the bronchi are dilating and the air is free flowing, and then your tissues are perfusing well.
Sounds good.
Alright, so just give me 1 second. Okay, so you were 88, then we did chest PT, and then you went up to 91. So now you're at 96.
Nice.
So it appears like the medication is working for you. And it appears like this is probably going to be something that you're going to be on going forward, going home. The medication teaching was good, so I know that when you go home, you know what you're doing. But like I said, like the pharmacist said, and like I said, if you have any questions, you just feel free to call. If you experience any adverse effects, call your provider immediately, and we'll be able to get you the help that you need. Do you have any other questions, concerns?
How often do I have to make a doctor's visit?
So the doctor actually informed me that he wants to see you back in anywhere from 3 to 6 months. Now, anywhere within that time frame before then, you can always just give us a call if you have any issues. We're here all the time. We're more than willing to answer your questions, or your sister Elena, if she has any questions, she could always call us too. And just another thing, just be aware that the medication that you are taking, it takes about at least 10 minutes to work. So if you don't feel anything within that first 10 minutes, don't take another puff, don't panic, just give it that 10 minutes at least, before you take another puff, because like I said, that's the onset is at least 10 minutes.
Got it.
So I know that the doctor, they're sending your prescription of Servant or Salmeterol over to your pharmacy now, and they're going to be able to give you all that stuff upon the discharge at the front desk.
Okay.
So,
Perfect.
do you have any other questions for me?
I don't have any questions, Elena. Do you? You explained yourself pretty well. Thank you so
thank
much,
you.
Andrew.
No problem. Like I said, whatever you need, you give us a call. We're here all the time, okay?
Thanks again.
All right. Take care, Dave.
See ya.